Pee Dee region has waited 30 years for this day and this event, 3 decades. Let me explain. Let me put it in context by taking the governor's history and moving it up to just a little more contemporary time frame, the mid-90s. In the mid-90s, we decided to deinstitutionalize mental health care by closing many of our residential centers in South Carolina and establishing regional outpatient and counseling centers across the state. Now, you know, in and of itself, that wasn't bad. It was a trend of the times. But as we're prone to do sometimes in health and human services, we overestimated the cost savings and we underestimated the explosive need. We also didn't allow for the complex problems associated with identifying and educating rural patients and arranging for them to be transported to remote centers, not just for initial treatment, but for the numerous follow-ups. You know, these mistakes came from the well-intentioned but naive decisions made by the DMH and other leadership in Columbia at that time. And by the way, John McGill came after that, okay? They understood institutionalized care, but not the myriad of problems that stem from decentralizing that care around the state. But I have to tell you, many of us who were there at the time are also to blame because we let this occur without asking the challenging and probing questions we should have. Now, the second mistake that was made 30 years ago involved the Pee Dee itself. The share of funding that came here was disproportionately less than that for other regions around the state, despite the fact that our portion of the population needing these services was growing at an exponential rate. Of course, this was further exacerbated by our substantial number of rural and underserved constituencies. Yeah, I know everybody here who's not from the Pee Dees thinking, here they go again, wah, wah, it's the Pee Dee crying about what they don't get. Well, you know what? Last 20 years, we didn't have much to cry about. And we certainly don't today with this effort. But 30 years ago, those issues occurred. And so we had 30 years of mental health treatment generally underfunded throughout the state and substantially underfunded within the Pee Dee region of South Carolina. All of which brings me to my friend, Hugh Leather, a legislator who continued to worry about these mental health treatment disparities, especially during the last 2 years of his life, and most especially during the last week of his life. That's right. During the last few days of his life, the chairman spoke extensively about the need for South Carolina to expand its behavioral health facilities and services. He shared his concerns with many of the people speaking here this morning. They listened, agreed, and that's why we're here today, celebrating a bold, new, and aggressive approach to treat behavioral health across the state of South Carolina. Now, no one ever spoke for Hugh Leatherman. He handled that pretty well for himself. But give me just a couple of minutes because I want to speak on his behalf and Jean's in extending thanks and appreciation for a few folks for today's occurrence. The governor, for being so supportive of this and so many other things affecting the most vulnerable people in this state. Most of us know that Chairman Leatherman never cared much for governors, feuded with one or two along the way. The Governor McMaster, you were one of the exceptions. He liked you, he admired you, and he had profound respect for the compassion and empathy that you have for the people of this state. And that's abundantly reflected in your support for this initiative. Thank you, sir. Mr. Speaker, There is great rivalry between Florence and Sumter over who really gets to claim it. We know that this is your real hometown, but we also noticed for a number of years you would put projects in the budget for Florence, while Senator Leatherman would put projects in the budget for Sumter. Now, some folks might just regard that as astute politicking. But among us over here, we know that's because you really wanted to have those projects here. Your heart never left Florence. Mr. Speaker, thank you for working with Chairman Leatherman on this last great project. The two of you accomplished so many things together, but this may very well be one of your most meaningful. And members of the delegation, thank you so much for your support through this process. We wouldn't be here today without everything you did as well. We couldn't be more appreciative as a community. We also want to recognize the support that Senator President Thomas Alexander and Finance Chair Harvey Peeler committed to this effort. They not only understood its importance to Senator Leatherman, but they understood its importance to the health and well-being of the state. Senator Reckenbach, thank you, and please express our appreciation to the entire Senate for their support of this initiative. Of course, a special thanks goes to our friend Robbie Kerr. Robbie and you had a close relationship that extended over a few decades. The chairman felt that no one in the country understood health financing better than Robbie, and the creation of this facility is a pretty fair indication that he was right. But I have to tell you, when this process started a couple of years ago, Robbie made it abundantly clear that the first region to receive a new behavioral health facility would be the Pee Dee. Mostly out of the recognition for the need, partly out of the respect to the chairman. Both are laudable. Madam Mayor, thank you for Florence's literal and figurative contribution to this project. This building shouldn't have been located anywhere other than Florence, and your determination, tenacity, and the strong support from our friends on City Council made this possible. Of course, those 250 additional jobs will be a welcome addition to the most hospitable city in the state. Finally, to David and Donna. The chairman would be so proud at the collaborative effort between MUSC and McLeod in launching this effort. Everyone here should understand that hospitals do not generate profits from offering behavioral care. That they do it because it's an imperative part of sustaining a community's health and treating its most fragile people. You had great confidence in MUSC and McLeod and their ability to accomplish both of these goals, especially with David and Donna at the helms. Thank you all for coming today, for being part of correcting a 30-year mistake and helping fulfill Hugh Leatherman's last and most compelling request for the people of South Carolina.